One of the implied risks associated with a vaginal delivery is tearing of the muscles and tissues around the urethra, the vagina, and the rectum. And when a woman tears, it is classified anywhere from a 1st to a 4th degree tear. 1st degree being the least involved and 4th degree being the most severe. It's not about how long the tear is, it's about how deep it goes or how many layers it extends into. Specifically, a 1st degree tear just involves vaginal tissue. It's very superficial. It's kind of like falling and scraping your knee. It's like a little skid mark basically, and it's very common for women to have 1st degree tears. It's also very common for women to have 2nd degree tearing, which involves vaginal tissue and the underlying perennial muscle layer. 3rd and 4th degree tears are more involved, and they involve the anal sphincter muscle to a certain degree. And basically a 4th degree is where there's not a distinction between the vagina and the rectum. And so the doctor needs to repair each individual layer and basically put things back together they were before the woman had the baby. This sounds terrible, and for anyone out there who has actually experienced it, it does take a couple of weeks to start feeling more like yourself again. But rest assured that these severe tears are not very common at all. And when the doctor stitches things up, those stitches don't need to be removed. They actually dissolve, and the doctor checks them out at the woman's postpartum visit to see if everything's healed nicely and as expected. If you're having your first baby, if your baby is abnormally large, or if the doctor needs to use forceps or a vacuum to help deliver the baby, then you're at higher risk for having more severe tearing, like a 3rd or 4th degree tear. But do keep in mind that if it's your first baby, or the baby's large, or the doctor needs to use instruments to help deliver the baby, it doesn't necessarily mean that you'll have a severe tear. It's just a risk factor for that. And a lot of women also want to know if there's anything that can be done to reduce the chance of tearing. A lot of women have asked if you need to do perineal massage or use oils to help massage the perineal muscles and help them stretch before delivery, and there's no research to show that that's actually beneficial. It basically comes down to the elasticity of your skin and how fast the baby's head is delivered. The more slowly the head can come through those perineal muscles, the less likely they are to cause a large tear. Think of it like this. If you've ever dressed a toddler, they have huge heads and their shirts are often small. So if you're trying to fit a small shirt over a toddler's head, if you pull really fast, it's more likely to tear the material. But if you pull it over slowly, then the material is going to stretch and it won't tear. And that's exactly what's happening as the baby's coming through during delivery. A lot of people have heard that epidurals will increase a woman's chances of having tearing, but the reverse is actually true. When you have an epidural, you're better able to control your pushing and help the baby's head to come out slowly, versus when you don't have one, you just have this huge urge to push. You push really hard and the baby's head comes flying out, you're more likely to tear. Another conclusion that a lot of people draw is that if they had a tear on their first baby, especially a significant one, then they're more likely to have a severe tear on their 2nd, 3rd, 4th baby. And that's not necessarily true either. Remember, a risk factor for having a severe tear is having your first baby, and so it's not necessarily an absolute that it will happen again. If you have more questions or concerns about your circumstances, talk with your doctor and they'll be able to give you tailored information and advice about it. And if you have more questions in the future for me, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.